Right. Hi. My name is Sarah, and I would like to welcome everyone who's joined in today. We can see that there are people from all over the world. So essentially, I'm very new to the UK system, and I think what I will try and do is walk you through my personal experience, just to understand, as both Dr. Savia and Dr. Anjum have mentioned before, the most important thing is to stand out in your application. And that's how you essentially get your first job. So first of all, before you even start applying, you need to first figure out what you want to do and how you want to apply and whether you want to apply into training or not. The first part of the presentation would be how you actually achieve a clinical attachment and why you need to do it and what's the importance of it when you later apply for a job once you're GMC registered. There's also the fact that at what stage of your training or what stage of your career you're going to apply at, whether you're someone who is eligible, who has given their PLAB exam, or are you eligible to get GMC registration on your postgraduate exams, for example, the MRCS and other exams like that. You also need to decide when you're applying whether you want to get into training or you don't want to get into training. We'll discuss a few of the different kinds of job types and the applications and how to actually prepare for the interview. Majority of this presentation will be on doing a demo of my own profile, just to give you guys a quick sort of taster as to what you need to put in, especially the supporting information, because that's very, very important. And then we can answer all your questions later on. So, when I was applying for my very first job, I had not done a clinical attachment. And all I had done was given my PLAB, gotten GMC registered. The good thing, what I had actually done was in year 5, I've done a clinical elective in the UK. So I used that as my NHS experience when applying for a job, which majority of the NHS trusts do accept. But now there are certain pathways that they've put in place because they've realized that every doctor that's coming in that they are hiring should have a little bit of NHS experience. So there are multiple websites out there. There's the BMA that has actually listed down all the hospitals in the NHS trust that have started a clinical attachment program officially, which was not there when I was applying. So basically, it allows you as an international medical graduate to gain an overview of all the systems of UK. So essentially, you're not learning the clinical skills that because you already know those. The point of the clinical attachment is to understand specifically what system are in place in NHS hospitals and how you do all the management things within the hospital. So within the clinical attachment, you're essentially just being an observer and you can't sort of make patient decisions and things like that. Now, when to apply for a clinical attachment, the best time would be when you're in line to give your PLAB 2 exam, because that's actually a reason why you would come to the UK. The best time would be to do it after your exam when you're a bit more settled. And then you've given your exam and it's out of the way. Obviously, getting a clinical attachment, I think, is one of the, it's obviously a hurdle, but I think now that employers have realized how important it is that overseas doctors have a bit of NHS experience, they've started these programs where you can apply for clinical attachment separately. Sometimes you can, if you're visiting UK to visit your family or friends that live in the UK, you can also do an attachment then as well. Now, there's a lot of paperwork that you will need, even for a clinical attachment. You will need one of the certified English tests, so either the IELTS or the OET. And obviously you're going to need a visa. You can do a clinical attachment on the visitor visa itself, or your PLAB 2 visa, which will also be a visitor visa. The PLAB 2 visa is for 6 months. You're obviously going to come to the UK. You probably will need a little bit of study time, give your exam, but you should have ample time enough afterwards to do your clinical attachment on the same visa. So this is one of the most important slides. If the candidates, if you guys want, can take a snapshot of the slide through using your mobile phone. This is on the BMA website, which I found yesterday, that these are all the trusts that are actually offering official clinical attachment programs. If you go on their website, they tell you which specialties the attachments are available and who to email and what documents they need from your side, and when do they in what months of the year do they allow overseas professionals to have clinical attachments. The other way you can find attachments is through your contacts. Apps UK is a very good platform to do that as well. Right. So when you find someone that's an NHS trust that's offering a clinical attachment, obviously they normally ask you for a cover letter. They ask you for your CV. They also ask you for a reference letter as well. The other way that you can do this is if you can email a consultant directly. This is a bit of a hit and a miss. If you check the hospital directory for the consultant's NHS email or ID, sometimes they do reply, but again, it's something that you can try, but it's a bit of a hit and a miss. Right. So job application. Because when I came into the UK, I was at an FY2 level, which means I had just done my house job and I got GMC registered with the license to practice. And the next level that I could apply was a foundation year 2. You need to know what level you are when you're applying for your first job, or what level you can work at. It might be difficult because sometimes you're back home, whichever country you're from, you might be working as a resident or a registrar, but when you come here, you might have to work at a lower level, just because you need a little bit of time to understand the processes here, because the process here is very different from how the process would be in your home country. You also need to understand, once you get your first job, is whether you're coming into the UK to be trained or not, because that would decide what kind of jobs you apply for. So most of the people attending this will probably be looking to apply for an NHS job. I've always found this debate online, whether when they start applying or getting jobs, whether to apply to a tertiary care center or a district general hospital. Is it easier to adjust at a district general hospital just because it's smaller, you have smaller number of patients, and tertiary care centers tend to be more specialized? I don't think it makes much of a difference. In my personal opinion, I came from a very large tertiary care hospital back in Pakistan. So my first job was actually in a DGH, and I found that very hard because DGHs are very resource limited depending on which district general hospital you end up at. And I think it's just a personal preference. You need to understand whether you are limited by location within the UK. So when you're actually applying for the job, do you only need to apply in one particular location? Obviously, that would restrict the amount of vacancies you find. For someone who is applying when they've just done their house job or their internship back home, what the employer expects of you is that you're not specialized at all. So even if you've not done a specific specialty, I would advise you to still apply for that. They have, for the SHO level, they have rotational posts as well, where you rotate in between different specialties. So they don't want, even if you have an interest, let's say in orthopedics, and they have a rotational post in ENT, general surgery, and other surgical specialties. But at the level of an SHO, I think it might be worthwhile just taking up those other surgical subspecialties just to get into the system. There's also this debate of whether when I was applying, there was this debate of whether you should work in a private healthcare setup first, just because the salary is more and you can just set your roots in the UK and then you can potentially apply for an NHS job later. When I was giving my PLAB, these private healthcare setups actually they sent representatives to us at the academy that we were studying, and they would send out leaflets. It's very interesting because you get paid more, and you work less, but essentially that won't count just because you're not working in an NHS setup. They're all private hospitals. Right. So how do you actually apply? A few of the other panelists that were before me have already mentioned and shown you the website. The most common ones are NHS Jobs and the Track Jobs website. Then there are other private care setups. There are private companies that can find jobs for you. However, I think as a junior doctor, if you're coming to UK as a junior doctor, I would not advise going to these resourcing websites, just because they mostly cater to people who are at consultant level or at a higher level. One of the very famous one is BDI resourcing. So they do everything for you. They will find the vacancy for you. All you have to do is give them all your details and all your documents, and they find the vacancy for you whenever it arrives. But as a junior doctor, I would not advise this because it doesn't really work. Right. So job application. So obviously when are you eligible to actually apply? Most of you would already know this. You need a primary medical qualification. You should have passed both parts of your PLAB, and either you are awaiting GMC registration or you have gotten GMC registration with a license to practice. One of the things that I noticed that other people have also mentioned, the other panelists, is that with the supporting information part of your application, everyone does it very differently. And it's very, very important that you're very specific to the job that you've applied for. A lot of people don't end up reading the person specification part of the job advertisement. That actually helps you understand what they're looking for. So you can actually tailor your supporting information to what they're looking for. That would make your application stand out more. I'll give you an example when I show you mine. If this is your first job in the UK, you need to decide, there'll be a lot of advertisements for SHO or junior doctor or a junior clinical fellow job, which is just an SHO is an umbrella term for all of these. But you need to understand whether you want to work full time. They also advertise locum appointment for services, which is a job where you don't work full time. And I would not advise to work as a locum doctor as your first NHS job. Make sure whatever job you're applying for has a contract of at least a 6 month. There are jobs out there that are only for 4 months, and I don't think that's a good idea to apply, in my personal opinion, just because you're going to end up looking for another job right after you've gotten into the first one, and it's very difficult to settle into a new system. And you need to understand what level you are before you apply for your job. So like the other panelists have mentioned, the SHO is the umbrella term, and that can include anyone from an FY2 and FY3, junior clinical fellow, someone who's equivalent to ST1, CT1. These are all names for the same level, essentially. Right. So key points of the application is that you make your application profile, try and put as much as of everything that you've done onto it, even if you've done any little bit of research back home. I know doing audits back home is very difficult depending on where you're from. But if you've done any sort of teaching, if you've done any little bit of research, if there's ongoing research, if there's an ongoing audit, if you've done any course, put it onto your application. It's very important that you put whatever you've done apart from your clinical aspects, because you need to understand that over here, doctors don't just do clinical work. They get into leadership, they get into management, and they get into research as well. It's very difficult to do all those things back home when you're not, that's not part of your training. But any extra bits that you have done, please try and include them in your application. It does help. NHS experience, I think now more than ever, employers, from my personal experience, are more adamant that people already have NHS experience. This is briefly from, I've been very lucky in the fact that whenever I've had a job, my clinical supervisor would be the departmental lead, or would be the one who would be employing people into the hospital for that particular specialty. So now they're more inclined towards you having NHS experience prior. And that that NHS experience should be at least more than 4 weeks, at least 4 to 6 weeks. If you can do longer, that would be better. About the supporting information, like we mentioned, you need to be as detailed but as precise as you can be. Add on things that would make you stand out, that you are suited to that particular role that you're applying for. For example, you cannot use the same application for an emergency medicine job and a surgical job, because you're essentially using one template and you're sending it to everyone, and it looks very haphazard, and you come out as that you're not focused enough. So make sure whenever you apply, change the supporting information bit of your application with every application. That would be my go-to for you. That's essentially what I did, because I applied to all surgical and emergency medicine jobs, but I would change my supporting information before I press the submit button, just to make sure that I read the person's specification and adjust it to ensure that whatever qualities you have fit for that job are coming through. Because essentially, when the panel that's going to read this has no idea of who you are, they've never seen you, they've never met you, they have 200 applications already for that post, and the only way that the HR department or the recruitment department is going to pick your application out of all those 200s is when they read your supporting information, because that's the only thing that's personalized. So make sure you have a very good supporting information section of your application. Right, timeline for job application. It will take a good 2 to 6 months. Hopefully you should get your first job in the first 2 months. And the applying stage is always very difficult. So for example, when I applied, I had to apply to 152 jobs before I got my first 3-4 interviews. So it does happen. You will just need to keep applying and be persistent. But you will get the interview. If your application is correct and it's suited to the job that you're applying to, you will get an interview. You need to alter, like I mentioned, you need to alter your profile and make sure you read the job description and the person's specifications for the job. When you go on the actual NHS website page and you type in whatever level of job you're looking for, the job advert itself always has some files attached to it. So one of them will be the person's specification and the job description. Make sure you go through those. Don't just randomly apply without looking at those, because those are important. That's what essentially the employer is looking for. And you need to make sure that, for one, you fit that job criteria. Two, you add on everything that's written that they would desire in a candidate onto your supporting information. For the interview itself, I would suggest prepare well for the interview, irrespective of what specialty you get the interview in, depending on where you apply. As a junior doctor, if within the interview, if there's any advice I can give you, is you already will know the clinical knowledge that they would expect from you in an interview. I think what you need to understand is how the system works, how to manage certain situations. And as a junior doctor, they want you to be a safe doctor rather than know everything off the bat from the books. So make sure you know what the concept of patient safety within the NHS, and that you always have someone that you can escalate to. That's very, very important. Right, so the applications, all the applications. So I'm from Alderhay Children's Hospital, and one of the registrars is actually going through all the applications currently. So I've had a little chat with them. What they essentially do is none of the clinical people are going to look at the applications, because there's too many applications. What they end up doing is they're all reviewed by either medical staffing personnel or recruitment teams, more often than not, if it's a big hospital. And then only the ones that are shortlisted are then reviewed by consultants or senior registrars who would be part of the interview panel. On the interview itself, you will have one clinical representative, which will be a senior registrar or a consultant. You might have two consultants if it's a rotational post, where you'll have one consultant from each. You normally obviously have one HR representative. And the way the interview works is that you normally have a clinical station and a management station. And in the start of the interview, they ask you to run down your CV or whatever you've done or your clinical experience. Before if you get to the interview stage, and hopefully with a good application, you should be able to, you need to have a few questions. So the interviewers are very keen if you want to ask them questions of things you want to know before you start the jobs. And you can also ask them things they would expect from you prior to starting. And if there's any sort of support that you need, they will give the support to you. Right. So I'm just going to share I'm just going to share my actual job profile. Right. So every job profile, so once you make your NHS job profile or your track jobs profile, it gets saved. So you can use the same profile again and again. So this is just personal information. And then essentially you put down all your qualifications in one place. So this is obviously afterwards. You need to put down all your qualifications up until now, including your IELTS, your PLAB, any other postgraduate exams that you might have given in your home country. Please put them down. All the training courses that you might have attended as well, including ALS or any other courses. Even if they're not UK certified, I would advise to put them down either ways. So this bit is very important, that you need to include all your employment history as well. Where have you worked, including all your employment gaps. They ask you for what were your duties and responsibilities. Be as clear-cut as you possibly can about this, and where you worked and essentially what your rota was like. If you have any gaps within your career, irrespective of how long that gap is, there's always a section at the bottom to put your employment gaps. Over here, people are very understanding of employment gaps as long as you have a reason justified for it. That's my personal experience. I'm not sure what's happened with other people, but I have put down all my gaps here, and it's very important that you let them know. You have a section for referees, so find out people within your setup who can referee, who can act as a referee for you. Someone who's your current employer would become your referee. If you have a gap, then you're going to need a personal character reference, which is just a similar thing. So these details don't go to the employer up until you don't actually get the job. So they will only contact your referees once you have the job. Now, this is the important bit, the supporting information. So if you have done any practical skills back home, mention this. If you have a logbook for it, that's even better. So there are places where if you have a logbook, do mention all of these, that whether you've done them independently or under senior supervision. There's a section here for teaching. If you've done any small kind of teaching and you have any evidence that you can show, even without evidence, I've still put it in. Any audit that you might have done. If you haven't done audits, that's fine. This application is for while I'm in the NHS. I did not have any audit that I had done before I got my first job. So that's okay if you've not done one. Any research you might have done back home or any ongoing research, please mention it. Even if it's not published, it's not completed, add all the journals that might have been published under your name. If not, that's okay. Right. If there's any management or leadership experience you might have, you might add this here, even if you don't have supporting evidence for it. Team working aspects. So you've obviously worked in teams in the clinical setting that you were at back home. Just give them a brief description of how you acted as a team member. You don't need essential evidence to support this at the minute. Now, this part needs to be very, very good. You need to understand that you need to read the person's specifications and the job description really well and tailor this part with every application. You can't make it generic. Right. I think if I could tell you any take-home messages on how to apply, you need to know when exactly you want to apply and what your career path is. For example, if I give my example, I know I wanted to pursue surgical training, and I needed a surgical job. So I wasn't very hell-bent on what kind of surgical job I get. I would apply to every surgical job that was out there and every emergency medicine job, because you can use emergency medicine as clinical experience when you apply for surgery. So I sent out my application to everything. So ENT, plastics, it doesn't matter. It didn't matter to me because I just need to get my first job. When you need to understand what role you need to apply for. So I was at the junior most role. So I would apply for an SHO job or an FY2 position, and make sure that your application profile is very well structured and catered to the job that you're applying to. Right. If anyone has any questions about job application, this is my email address. I would be very happy if you email your queries to me. I would respond as quickly as I can. Specifically, if is anyone looking to pursue surgery or training in surgery within the UK, I would be very happy to assist with that as well, because that's essentially the most I would know about at this stage. And thank you so much for joining us.
Thank you so much, Sarah. I must say your presentation and your talk is really good, because you not only touched upon how to find the job in UK, but also you mentioned about the clinical attachment, which